Good evening. We've heard a lot about British Columbia, and yet, British Columbia is a province where we have the best health outcomes of anywhere in Canada. And it's been because we've had social impact on how people live their lives, how they choose to make choices, and how we influence disease processes. And yet there are some things that stand in our way still. And they are the silos that John alluded to. But those silos are very real. This is an example of the healthcare system plotted out regarding medication use. And inside the silos is not education, but interactions in the real world. Interactions that are complicated. Now, we've built our healthcare on a vision of a number of characters. Some of you will remember Ben Casey in the days when televisions were in black and white, and Dr. Kildare, and both of them had a mentor but had no team. And in fact, probably the only one to have a team was Marcus Welby. And indeed, we took medical education and we tried, as this set of pictures from Patch Adams shows, to train the humanity out of you. And of course, this was from Dean Walcott, and it was to the incoming class at that university. But in fact, it was never that. That was actually Hollywood. And we had leaders in healthcare that spoke to the safety and quality of patients and have put them in the center for years and decades. Florence Nightingale and Ernest Codman were two examples who emphasized the importance of quality and measurement. Now, we rely on teams now in healthcare. Healthcare is too complicated for a single individual to affect significant change. And for those of us that lived in the Okanagan during the fires, there were a number of things we could learn from high-performing teams that battled those blazes. And there are other teams, the Vancouver Symphony Orchestra, playing perhaps this evening down the street. A group of individuals, unique in each of their individual skills, but coming together to achieve a common goal. And that teamwork is fundamental to the future. It's built on a knowledge and recognition of individuals like Robin Humphries, a neurosurgeon at the Hospital for Sick Children, who practiced, who developed, and who worked with many people to develop the best in their character, and showed me the true value of teamwork. So what is my hope for British Columbia in the next short term? And that is that when we need care, you and I, that we will be treated by highly effective teams, and that the transition in the care pathway will be uncomplicated and perfect. And so let me introduce you to a team. This is a group of individuals that work at the Children's Hospital. They're a village that take care of kids who have congenital malformations of their spinal cord. There's a great number of them. They have all individual responsibilities, and yet the focus of these individuals is the patient. The example is this boy, Adam, and Adam's a 3.5-year-old who clearly has a highly dedicated mother and family, but who has a team behind him to support him in his medical, his physical, and his emotional needs. Now, Adam's a unique young man because he had his spinal cord operated on while he lay within his mother's womb at about 22 weeks gestation. This was done at the University of Philadelphia, and he now has better neurological function than he would have had otherwise. A major study, and in fact the goal, of course, of that work was to achieve what we see in these pictures of these patients. The guy doing backflips on a sit ski, maybe Mr. Dryden's next generation hockey player, or the world champion speller. So there are a number of things that I think Ben and Robin and the conductor for the Vancouver Symphony, Mr. Tovey, have in common. They are leaders. They recognize the importance of teamwork. They are aware of things going on about them, and they make decisions. And so at Children's Hospital a number of years ago, we began to ask the question of how well do we work as teams? We're interdependent, we're a group of individuals, we have tools, we have techniques, but we're all dependent upon each other in order to achieve the goal we wanted for the patients that we cared for. So about a year ago, a number of folks, some in this room, sat around and had a good look at what we were actually doing. And that opportunity allowed us to recognize that the technical skills that many of us bring to the care of children in the operating room were necessary, but were insufficient to complete the care of that particular child. And so we saw in Hollywood, Dr. Benton in one of the last ER issues, introducing the surgical safety checklist, an area of leadership in that particular vignette. And as you probably remember, it was followed by a nurse who had the back of the somewhat arrogant and off-handed transplant surgeon who had the reperfusion solution available for rescuing the kidney when Dr. Carter's kidney thrombosed. Leadership, situational awareness, and teamwork. And when you look at all of this together, in the operating room, there is a harmony. The harmony that we see at the Orpheum Theater from time to time when we enjoy it in a symphony, and when we see people working together in an interdependent way for the sole purpose of achieving a goal for patients. It's my wish that when I need treatment, I will have such teams working for me, and that the transitions in care that I need to go through will be perfect. Thank you.